This video will explain how your heart works, what happens when things go wrong, and what you can do to keep your heart healthy. The aim of this video is to provide an overview of how the heart works and about coronary artery disease. It will explain how the heart pumps blood through different chambers and valves, what coronary artery disease is, what angina is, and what to do if you experience it, what a heart attack is, and how to react in an emergency. Some of the tests and procedures doctors use to check and fix heart problems. The difference between a heart attack and a cardiac arrest. The heart is a powerful pump which delivers blood to all of the body via arteries and veins. The heart has two main pumps. The right side pumps the blood to the lungs, and the left side pumps the blood to the rest of the body. Heart valves are structures in the heart that control blood flow by ensuring it moves in the right direction. The valves work like one-way gates, opening to let blood through and closing to prevent backward flow. The heart has 4 valves, each designed to open and close with every heartbeat. The tricuspid valve is positioned between the right atrium and right ventricle. The pulmonary valve is positioned between the right ventricle and the pulmonary artery. The mitral valve is positioned between the left atrium and left ventricle. The aortic valve is positioned between the left ventricle and the aorta artery. The heart has its own blood supply, which are the coronary arteries. There are 3 main coronary arteries. Left anterior descending, LAD, which supplies blood to the left side of the heart. Circumflex, which supplies blood to the back of the heart. Right coronary artery, RCA, which supplies blood to the right side of the heart. Coronary heart disease is when fatty plaque builds up in the blood vessels or arteries. This build-up limits or blocks the blood flow to the heart muscle. When the blood vessels become blocked, it can cause angina or lead to a heart attack. Angina is a warning sign. It tells you your heart might not be getting enough oxygen. You might feel a tight, heavy feeling in your chest, pain spreading to your arms, neck, jaw, or back? Shortness of breath. So what should you do? Follow the GTN spray protocol. 1. Stop what you're doing and sit down and rest. 2. Take your first spray of GTN and wait 5 minutes. 3. If it doesn't help, take a second spray and wait a further 5 minutes. 4. If the pain has not gone away or feels worse, call 999 immediately. A heart attack happens when plaque in an artery breaks open, causing bleeding inside the blood vessel. The body tries to stop the bleeding by forming a blood clot. This clot blocks blood flow to part of the heart. If this part of the heart doesn't get oxygen and stops working properly, symptoms of a heart attack include heaviness or tightness in your chest. This may spread to your arms, neck, jaw, back or stomach. Feeling of severe tightness or dull ache. May also experience shortness of breath too. Nausea or vomiting. If this happens, call 999 immediately. If you see a healthcare professional about suspected heart problems, they might complete several tests and ask questions about your medical history and symptoms. They may measure your blood pressure, take blood tests to check for signs of heart damage, and complete scans like X-rays or heart ultrasounds to get a closer look at your heart. A coronary angioplasty, also known as a stent, is a procedure to open narrowed or blocked arteries in the heart so blood can flow better. This is how it is done. A thin tube called a catheter with a balloon on the end is inserted into a blood vessel, usually in your groin or wrist. The balloon is guided through the blood vessel to the blocked artery in your heart. The balloon is inflated to widen the artery by pushing the blockage, plaque, to the sides. Often, a small mesh tube, stent, is placed in the artery to keep it open. The balloon is then deflated and removed, leaving the stent to keep blood flowing smoothly. Sometimes it is not possible to open a blockage using a stent, and coronary heart bypass surgery is needed. This is how it's done. A healthy blood vessel from the leg, arm, or chest is removed and used to create a new pathway for the blood to travel through to bypass the blocked artery. This new blood vessel allows oxygen-rich blood to reach the heart muscle. People often mix up heart attacks and cardiac arrests, but they are different. A heart attack is a plumbing problem. It happens when a blocked artery stops blood flow to part of the heart muscle. If this happens, you will feel chest pain, shortness of breath, sweating, nausea. The person will be awake. Call 999 and try to keep them calm. In comparison, a cardiac arrest is an electrical problem. It happens when the heart suddenly stops beating due to an irregular heartbeat. If this happens, you will suddenly collapse and become unconscious and not breathing. Call 999 and start cardiopulmonary resuscitation, CPR. All videos have been developed by the Northwest Coast Cardiac Clinical Network and partners. Videos are available covering the following topics: adult basic life support, cardiovascular risk factors, coronary heart disease and how the heart works, healthy eating, mental health and well-being, physical activity and exercise, understanding your medicines. Videos are also available in the following languages: Arabic, British Sign Language, Cantonese, Polish, Romanian, Russian, Urdu.